Today's bonus episode of HIPcast is brought to you by Harris Data Integrity Solutions. Embark on a journey towards unparalleled excellence and reliability in healthcare data management. Harris Data Integrity Solutions merges the expertise of Just Associates and QuadraMed Corporation, paving the way for a brighter future in patient data integrity. You'll have peace of mind that you are working with a SOC 2 Type 2 certified vendor. With SmartIX, achieve a unified enterprise master person index, ensuring seamless patient records across your enterprise, your entire health system with precision and accuracy. CureMatch offers modern, automated HIM workflow solutions, empowering HIM teams with efficient patient duplicate detection and resolution processes. Streamline your MPI maintenance with Harris Expert teams and tailored MPI cleanup solutions, saving you time and minimizing errors for sustained data integrity. Discover the power of Harris Data Integrity Solutions, shaping the landscape of healthcare data management. Explore their comprehensive offerings today at harrisdataintegritysolutions.com.
We are so excited. Lauren Riplinger is here with us today. Lauren, I don't know if you know this, but you're famous on this podcast.
It's better than being infamous, right?
Much better than being infamous. Your name has been mentioned on probably 3 or 4 of the shows that we've recorded already. It's always with admiration and respect. From a policy standpoint, AHIMA is always prepared to lobby for the things that matter to our profession, and that is largely in part due to you. Thank you.
Oh, thank you, Shannon. That's very kind of you. And it's a pleasure to be here as well. I can't take full credit for preparation. I have an amazing team that sits behind me as well. So really just focused on delivering the best quality of service to you all.
And you do. So I'm going to read your bio for our listeners. Lauren Riplinger currently serves as AHIMA's Chief Public Policy and Impact Officer. In this capacity, she is responsible for providing strategic and operational oversight of AHIMA's advocacy and programmatic strategy to demonstrate mission impact. Prior to that, Lauren served as Vice President of Policy and Government Affairs at AHIMA, overseeing the organization's policy and advocacy before Congress and various federal agencies. With 2 decades of healthcare policy experience, Lauren previously worked on Capitol Hill, where she was actively involved in almost every aspect of a congressional office, including serving as Chief of Staff, a position that requires the ability to quickly synthesize multiple issues and adapt to constantly shifting priorities. Lauren received her JD from the American University Washington College of Law and a Bachelor's of Arts from Vanderbilt University. She's admitted to practice law in the state of New York. Lauren, thank you again. We are so excited. So we're coming off the heels of AHIMA's Hill Day advocacy. I don't know. We've called it a lot of things over the years. It's had many name changes in our profession, right? It's had that many name changes. But our Advocacy Day in DC, where you and your team prepared all of our professionals and delegates that participated on debriefing on what's important and how to shape that message. So today we're just gonna talk through kind of what does it look like, what's the summit look like, what kind of things did you talk about there, and then why is it important? Why is it important that AHIMA has advocacy as a profession and as a group of professionals serving patients?
Shannon, we are 4 minutes in and I'm already about to go off script. So we do a prep document. And today's bonus episode is dedicated to the recent advocacy summit for AHIMA. And we're going to talk about that. But you said something in Lauren's bio that really sparked a question in my mind that we ask.
Always dangerous.
Yeah, it sparked something because we always ask people about tech-enabled advancements for their specific area. Yep. And Shannon mentioned that as your chief of staff role, you had to synthesize large amounts of information down into a palatable piece of information for a representative, right? Does AI play a role in that going forward for folks to be able to synthesize large things? And then how do you trust that and play that with the politics? Totally unrelated, but it was a fun thing that
That
popped
is
in my
fun.
brain.
Yes.
Yeah, I will tell you, great question though, right? Because people are trying to grapple with that in congressional offices right now. So there are, offices that have talked about how do we use AI to create memos and memo briefs for their member of Congress, and they are using things like ChatGPT today. So, the feedback I hear is it's great if you want to provide really a broad overview over a particular issue, right? But if it gets into anything more granular than that, it's really difficult. And so you are starting to actually see that. Now, will it kind of advance into things like constituent mail and things like that? Still TBD, right? I think it does require still some of that expertise to understand what is things like high tech, what is HIPAA,
Yeah.
all these different statutes. But you're definitely seeing staff starting to rely on it and questions in the office of how do we govern the use of these tools? Because nobody wants to be in the headlines that says, we use this technology and the wrong thing went out to that constituent. So
Yeah.
it's a challenge. They're trying to work through it.
All right. That was a bonus question for the bonus episode. Now back to the regularly
Do I get extra
scheduled
points?
topic.
I feel like I need a buzzer.
Well, you get extra points because you went to Vanderbilt and we're in Tennessee. So yes,
That's right.
you got extra points already.
All right, let's get back to the actual question that I was supposed to ask at this point in the podcast. Tell us about the Advocacy Summit that just occurred a couple weeks ago there in D.C., and I assume the cherry blossoms have blossomed.
They have, and now they're all on the ground because we got 3 inches of rain this past weekend. So it's perfect timing. No, but about I guess about 2 weeks ago, we had our annual Advocacy Summit, which we were sad that Shannan and Seth weren't able to join us this year, but we hope they'll join us in the future.
We should do a live podcast from the next one.
We should.
That would be amazing.
That would be a winner. Yes.
I would highly thumbs up for that. So.
Okay.
But it's a great event. We've been doing this. I was talking to Colleen Goethals, who's in the AHIMA delegation. I mean, she's one of the first people who went to the original ones. I mean, since the 90s, we've been doing this Advocacy Summit, which is a huge, amazing thing for the membership to acknowledge that you all have had a presence on Capitol Hill for a very long time. And I think that's really important that we acknowledge and celebrate that, quite frankly. But the Advocacy Summit, for folks that aren't familiar, it's really a 2-day event. So day one, we bring different policymakers in and talk about the issues that, our membership might have questions about. Things like AI, privacy and security, ICD-11. Yes, we are talking about ICD-11, social determinants of health, but also the politics in which the policy making gets done, which is really important that we consider that. So just a variety of different issues. Patient matching was another topic. So we focus on that, helping our members be able to be in close contact with our policymakers and ask questions, because we all know at the end of the day, those decisions that are made by those policymakers have an impact to the field. And it's really important that health information professionals bring that perspective to the conversation. And then day two, we kind of shift gears and we go to Capitol Hill and we advocate on legislation. So this year we focused on newly introduced legislation that AHIMA has been pushing through our work with the Patient ID Now Coalition called the Match It Act, which really seeks to improve patient matching by identifying a set of data standards. And there's a series of steps involved with that legislation. But that was one of the key issues we took to Capitol Hill. And, members have a chance to meet with their representative and their senators, which is, a experience unlike any other, as both of you all well know.
It is. It's wonderful. It's one of the, in fact, Seth and I, we love walking around DC. We love going to the Advocacy Summit. We love to walk around and see. I think one time we were there and we saw Marine One land on the lawn. It was like, that is cool,
It was very cool.
And then the gate off the entrance to some street, and we're like, what's happening? What's happening? We stick around for that. So as a health information professional, if you haven't gone to Advocacy Summit, the way we used to do it, I think this is right, it had to be a delegate. So you have to be serving in your state's association as a delegate, whatever role that is in your state, president, president-elect, past president, or an actual delegate. and then you could go. But now it's open to anyone that is a
Correct.
health information professional. And going is amazing because you're networking with a few hundred people that have the same message that you're taking to the Hill, to all the representatives, to all of Congress, right? To say this is important to the patients in the United States of America. This is important to the longevity of healthcare in the United States of America. So besides doing the important work, it's just a ton of fun to get to network, and also the history. Man, the history around there, it's so much fun, and the food. You can't beat it. So, all right, so you talked a little bit about the Match It Act, Lauren,
Oh,
and
but Shannon, before you go back, I do want to highlight something because you hit upon the point of networking. And I think what's
so
really
good.
important to recognize is it's not just networking with your peers, it's networking with congressional staff.
Yes.
Because one of the things we also talk a lot about is, we can go in anytime, we can meet with these representatives, we can provide that perspective. But who they really want to hear from is people who live in their community, people who live in their state, in their congressional district, and being able to hear from, Susie Smith that works at Mercy Hospital in St. Louis, where that member of Congress probably gets his care or her care or has a family member that goes there.
Yeah.
That is much more impactful than, the more 30,000 point of view that we can provide as policy staff. So I think that's a really important thing to call out, and the value that attaches with being able to build those networks and relationships with congressional staff when you're here in Washington.
When it's not just the representative, it's also
right,
the
the
legislative assistants, the folks that work in the office.
Exactly.
We made some incredible contacts through the state of Tennessee, and those folks, they left D.C. and started working for different places in Nashville, in our state capital, and they reached back out to us and said, hey, we know you guys are the experts on this. Would you mind having these conversations with the new group that they're working with? So it's networking beyond even just, like you say, our group and the representative, but even with the what are they called? LAs there on the Hill. Listen to me, I'm all fancy. I know the terms. I know the lingo. I've even ridden the train between the congressional building to the Senate offices, I believe is what it is. So a lot of folks don't know that there's a roller coaster down there underneath the ground. And we were running late for a meeting, and I asked I guess it would have been the legislative assistant that was with the office. I said, hey, we're trying to get over here. We have to go through security if we go out, blah, blah, blah. Can we ride the secret roller coaster through here? And he was like, yeah, come on. And it was a lot of fun. So I can now say that I've ridden the secret train underneath DC.
That's right. Too funny.
Yeah, and it is. But what you all point out is really important, the networking with your colleagues, and as a member, networking with staff of AHIMA. A big important relationship is networking with the staff of AHIMA, networking with our congressional representatives, but their staff. I mean, all of those things are, it makes you smarter about how to have a conversation about what is happening in the industry. And I'm never going to tell anybody don't get smarter, right? Like, I am a pusher of education, so educate yourself. And the staff really does a great job of preparing those documents and the message. Here's the message. So don't be scared. That's another thing I should point out. If you're going to go to advocacy for the first time, it's a little intimidating. If you've never lobbied for anything or gone and had a meeting with a congressional member or their staff, it seems a little overwhelming because you haven't done it before. But truly, the staff and the network that's there already prepares you. So take the step. It's worth it. Absolutely worth it.
I would agree. And, the other thing I shared with someone, we had a new attendee this past year, and I said, there's so many people who come to that event year over year, like both of you, right, that have done this many times. And what I always love at Advocacy Summit is there's always a willingness of someone who's been a long time and in attendance that will say, hey, I'll come with you for the meeting, and they go to the meeting, and then the new person says, I got this. I got it. Like, I'm covered. It's just that one meeting, right? To get over that hump of that anxiety of, is it going to be West Wing style, right? And it's congressional staff are really looking to you all to help fill those gaps and grow their knowledge around a particular issue.
Yeah, that's awesome. So you spoke about the Match It Act, and very important. Maybe if you want to give any more just a little more detail about what the Matching Act would mean to us as health information professionals. And then what other topics did you cover on the Hill that day?
Absolutely. And perfect timing, right? That Harris is a sponsor of this particular
Perfect. Very
podcast, right?
perfect
We're
timing.
talking about patient matching.
Yes.
But I'm sure many of your listeners know that, excuse me, when it comes to patient matching, we don't have a definitive definition of what is a patient match rate to begin with, right? So, one hospital might measure theirs differently through their vendor versus another, or they might have, different systems stacked on top. They might use a biometric in addition to their algorithm within their EHR system, right? And so because of that, when we go to kind of try and take a national perspective to this stuff, we don't have a clear understanding of is your match rate the same as my match rate technically, right? And so one of the first items of this legislation is that it defines that patient match rate, right? Directs the Office of the National Coordinator. But going beyond that, what it says is it asks and calls upon ONC to develop a set of demographic data elements that could get us 99% match rate regarding patient matching. Now, it doesn't necessarily put that obligation on the vendors, but rather says, if you could, here are the demographic data standards you need to look at. So things like phone numbers, maiden names, all those different things we think about, right? So that's one aspect of it. The other piece is it also requires the vendors to adopt certification standards to support that. So eventually, at least to a 90% match, those vendors are required to adopt those demographic data standards at a certain point in time, right? And a lot of that is being done through the U.S. Core for Data Interoperability process, or the U.S. CDI that folks might have heard, right? That it basically is the new version of the CCDA. When we're thinking about that, right? And so that's kind of the third aspect. But we understand that as much as we are asking vendors to, be obligated to include those demographic data standards, we also have to recognize that, we want to get data from the providers. So it's a voluntary attestation that providers could share their data with CMS as part of the MIPS program and the Promoting Interoperability program to understand and report some of those patient matchings. Again, it's not a mandate on providers. So we're not trying to add burden to providers whatsoever, because we've all lived that burden on a daily basis, right? And we recognize that. But rather, how do we, if people are willing to share that information, how do we get more of that data and then allows CMS and ONC to work together to examine, how do we raise all boats, so to speak. So there's a couple different components to it, but, we really wanted to kind of continue to focus on repealing Section 510, but recognize the political realities that, there might be another alternative pathway that we can pursue to really address this increasing problem of patient matching and patient misidentification.
The political piece is something that's very important there, right? Because that's something we've struggled with for many years, is the privacy side from some of the representatives that struggle with what the intention was behind the repealing 510, the language in 510, right? So that's a whole other problem that you guys have to deal with in our DC office, is not just the mechanics of what we're trying to do for the industry, but then you have to deal with the political side of it, because you are in DC and there's just a little bit of politics that happens in that town, I believe.
Just a little bit.
Just a tiny amount. Nothing significant.
But Shannan, you asked about the second issue we took to the Hill was really around artificial intelligence. So we've, it's the buzzword of the day, right? That everyone's talking about. And what I find really interesting for this profession is that you all have been using a lot of non-clinical AI for a very long time, right? So when we think about patient matching algorithms, computer-assisted coding, autonomous coding, these are all tools that you all are very familiar with. The thing is, though, is that, Seth, to your point, and kind of the politics, right? I personally believe that non-clinical AI is not paid as much attention to in the policy conversations. But it has real repercussions when we think about patient safety, being able to get treatment that's not delayed, right? Because we're using bad data and certain tools that make assumptions, bias, also kind of, decisions related to payment as well, right? All of that has an impact. And so the second piece we went to the Hill with was a proposal around, how do we understand this landscape of the non-clinical AI world a little bit better? What are the challenges? What are the opportunities? And then it sets up some certain provisions related to an education campaign with the Office of the National Coordinator and others to really get this broader conversation out there and the importance of upskilling, because we know that's going to be critically important and something we've heard from all of our members of we really need to get a grapple on how are we upskilling our current
Yes.
and future HIM professionals to support this wave of AI that we know is coming.
Yeah, I want to ask a question. I'm very focused on some of what you're talking about. There are a lot of requirements around in like HTI-1, right? There's a lot of requirements around the DSI, I think is what it is. And basically, what algorithm did you use? And if you use sources to help determine a protocol or a best protocol, what you got to cite those sources, things like that. And then the bias in the algorithm. What kind of testing did you do as a vendor to prevent bias? Show me your work, essentially. You have to show me. I have to be able to look at it as a healthcare provider or agency or entity, but also it should be available to the public for the public to understand. But from a perspective of the legal medical record, we got a problem. That is not in any of the standards. The outputs and the process that you just talked about, that's not in I get it. The clinical focus is the most important because you got to make sure that everything you're building is appropriate, right? Everything that you're going to use to make a medical decision, 100%, that needs to be top priority. But that doesn't mean those other things are an afterthought. Kind of like hospitals were to meaningful use. Oh, wait, we are going to do this to physicians, but we forgot about those hospitals. Maybe we should put those on that too, right? We can't do that with legal medical record documentation and health information, right? And we can't do that with processes. I wanted to ask, the question was, sorry, I got on my soapbox there for a minute. I apologize for that, but I really wanted to ask the question of the opportunities in this for a health information professional. Tennessee, you probably know, Tennessee put forth a new credential to be considered for health data integrity. And when I think of, because we wrote that, I know what that entails. And I just think, man, is this an opportunity to take that health data integrity administrator, whatever it's going to be called, and plug that in to this work so that you help define the standards in health information.
Yeah, I mean, a couple things from the policy perspective. So I think one, as it relates to HTI-1, some of the non-clinical technology is included if it's integrated into the EHR, right? So the kind of way the DSI provisions work is, if an EHR vendor has the technology in their platform or in their module, then they're kind of on the hook for that transparency piece, right? And they have to provide it. But to your point, Shannon, not every AI tool is a certified EHR product or found in a certified EHR platform, right? So we have to recognize that there's a gap there that really needs to be looked at. So I think that's the first thing. The other thing I'd say, from my perspective, is because you all have been working with this technology for a long time and trying to think through some of these issues, when it comes to things like, data governance, how do we manage the governance of these tools? What is the risk management process that we take as it relates to this technology? These are all things that you all have been thinking about for a long time, because I would argue, and Seth's going to kill me when I say this, it's information governance, right? This isn't rocket science to many of you all.
Yeah.
One of the things that really stood out to me at the Advocacy Summit, where Director Melanie Fontes Rayner from the Office for Civil Rights spoke, she said, we have to remember that we have an obligation to protect PHI under the HIPAA privacy and security rules when we're using AI tools. So what I took that to mean was, don't throw the baby out with the bathwater. At the end of the day, we're still dealing with PHI. We're dealing with technology that, I mean, certainly are there opportunities for improved oversight? Absolutely. But, we have to recognize, go back to basics in some respects. And we can't forget those basics when we work with this technology.
Yeah.
Yeah, it's very true. And it's complicated, but one of the things that I want to end on is an encouragement to those that are listening to this, because this can feel like a heavy topic to a lot of folks. These are a lot of acronyms and things that not everybody knows and not everybody's familiar with. There's a lot of subjects that we talk about that not everybody's familiar with. It's not part of their daily lives, but that you have a friend, as we mentioned earlier. You have a friend when you do this advocacy effort at the national level, but this advocacy effort also applies to the state level and to your local office. So, Lauren, I know that you and I've talked about this for years, the importance of advocacy at the national, state, and local levels, but I'm curious of what your comments would be on that, and then I'll share some stories as well around our experience with it.
Yeah, we've been talking about this for a long time, haven't we, Seth? I mean, I think it's even more important now than ever, right? I mean, being able to have that presence in Washington, being able to build those relationships with your members of Congress, it's important. I have this general philosophy, right? I said to someone earlier today, I said, no one's going to look out for you except yourself. It's a very DC swampy statement, so I will fully admit that. However, there's a certain reality in politics around that, right? Yeah. And I say that to health information professionals because, and AHIMA is obviously representing you all, right? Please don't get me wrong on that. But, being able to participate in this and have your voice, there are many different issues that are in front of members of Congress on a day-to-day basis, right? And being able to have that presence through having staff to support these issues, but also you all coming to Washington, going to town halls back in your state, having meetings in your congressional district or in your state with district staff. If you can't make it out to Washington, there's many different ways to do it. And it puts you in their minds, right? To Seth's point earlier of you build the relationship, you're the people that they call at the end of the day when they need help on something. And so for me, I've always found it so critically important to engage on these issues because you don't want the world to pass you by. And that's why I think it's so important.
Yeah, it's incredibly important if you get the opportunity to go to DC, go to DC. I mean, that's just a fun thing. Go ride the roller coaster, go watch Marine One come in. But not everybody has that opportunity. DC is also one of the most expensive cities in the world. Yes. And it's tough to travel to. It's tough to get in and out of. But where I live in Northeast Tennessee, it's incredibly easy to reach out to my local representative's office and say, hey, I'm the local health information professional that's here. Our national association is doing advocacy work in DC this week. Is it possible to meet with somebody in the office? It may not be the representative. It may be a legislative assistant or somebody locally. And 9 times out of 10, that's a much easier meeting than it is going to DC and putting on a suit and trying to remember how to tie a tie and doing that full gamut there. You can do it locally, and it's so much more relaxed. And then you can have those conversations. Here's what we're talking about. Here's what we're working on. Because what I've learned from Lauren, because there was a time that I thought, maybe I should go into politics. Maybe I should do this.
Right.
Because the reality is all I wanted to do was to ride. I wanted to drive the tractor at the front of the parade and the roller coaster. And Lauren asked us a very interesting question to me one time when I was like, what do you think? Should I do this? And she said, do you care about other industries like trucking or agriculture or whatever? I'm like, no, I care about healthcare. And she's like, well, then you would be more into policy, not politics, because these folks have to care about everything. Yeah. When you have to care about everything, you don't know about anything. Yeah. You know very little of all of these industries that they have to cover and all the constituents that they have to represent. So having a friendly, at the local level, at the state level, at the national level is critical for these staff members, for these representatives to know when something comes across their desk that's related to health information. They're going to go, oh, I remember meeting Shannan at whatever in my office. I'm going to call her or email her and say, hey, would you help us understand this? Would you help us synthesize this? Because AI just told us that it was something crazy because we tried to use ChatGPT and it's based on old data. Right. So the national level is a lot of fun, yes, and we encourage you to do that. The state of Tennessee is a lot of fun. We do a state Hill Day. I still call it Hill Day. A state advocacy summit.
I still think they call it
Hill Day here in Tennessee.
Because we partner with the Tennessee Hospital Association. That's important partnership, right?
That's right. An absolute critical partnership. And they get a lot more meetings because we're with the CEOs and CFOs of these hospitals and we go along with them. And then at the local level, because it's so easy to get into these district offices and have conversations and to advocate for our profession and for these items like the Match Act to be able to push those through. So, that's my encouragement. And Lauren, any parting comments on my sermon there?
I'll just add, one, we're always happy to help with folks that say, look, I don't have the budget or, the time to travel to Washington, but I really want to meet with my representative back home. We're always, as a policy team, we're very happy to help people. We've created a toolkit, even like templates of how you can request a meeting with your congressional staff back in the district, particularly when they're in recess, when the members of Congress come home. So I think that's really one key piece. And then Seth, we don't do state level advocating, but to your point, I think it's really important for folks to really look at what's going on in the states because there's a lot of health IT related issues. Minnesota's got some privacy stuff going on right now. California had some TEFCA related stuff, the Trusted Exchange Framework and Common Agreement. There's also lots of conversations in states like Maryland around reproductive health information and how do you share that data, et cetera. So I think it's, the states are a key area that people should keep an eye on because what we're finding is, sometimes they can move faster than Congress these days. Like at the federal level, it has an impact on what you all do on a day-to-day basis.
It does. And you mentioned the toolkit, and I just want to tell the professionals who haven't opened this particular email from AHIMA when it comes out in e-blast or has opened it and thought, I don't understand what this is. AHIMA, thank you for this, Lauren. You guys in the team have done such a good job at when there is something for us to advocate for. I get an email in my inbox from AHIMA and it says, tell your representative to support this bill or tell your representative not to support this bill. All you have to do, listen to me, members, all you have to do is click the button. They have already got you associated based on your member information. They've got you associated with the appropriate representatives at that federal level. You just go in and basically sign your name and you're just sharing the same message from AHIMA that all your constituents across the country are sharing with their representatives. So there is a unified message and it's super easy. It seriously takes like a minute and a half to do. So open that email and if you believe in the mission of that particular advocacy opportunity, then click those buttons and do that. It's really, really important. So, Lauren, thank you so much for joining us. It's always a pleasure to get to see you. I told Seth after this advocacy summit this year, I said, we have got to go back next year.
Yes, I would agree. We just need to commit. That, both of you.
It's something, we miss it terribly. So thank you for coming. We appreciate you always and all the work that you and your team do to keep us members on a good trajectory to protect the information that we're using to help people empower their health. So thank you.
My pleasure. And thank you all for just continuing to be huge advocates for this profession. We always say this, we cannot do this work alone. And so everyone who's listening, just thank you for all of the advocacy efforts you all have also engaged in over these last few years.
All right.
Yep. And let's thank today's episode, bonus episode sponsor, Harris Data Integrity Solutions. Join us on a journey of excellence into the future of data integrity. Harris brings together the unparalleled expertise of Just Associates and QuadraMed Corporation to revolutionize healthcare data management. You'll have peace of mind that you are working with a SOC 2 Type 2 certified vendor. With SmartAx EMPI, you establish a single source of truth across your entire health system, ensuring accurate patient records with up to 99% accuracy. CuraMatch HIM Workflow Solution offers an automated HIM workflow, eliminating cumbersome processes of remediating duplicates using spreadsheets while reducing errors. Say goodbye to time-consuming MPI cleanup maintenance. Harris Expert Team delivers tailored solutions for efficient MPI cleanup customized to your facility's needs. Experience the power of Harris Data Integrity Solutions, shaping the future of healthcare data management today. Visit harrisdataintegritysolutions.com to learn more. Shannan, until next time, my friend.
I'll see you next time, buddy.